Welcome to another episode of Under the White Coat. I'm Dr. Sam Elfassy. I'm pleased to be here today, and I'm joined by Dr. Michael Verbora. This is actually a very interesting, exciting talk for me. You know, other guests we've brought on have been sort of in fields that we are experts in ourselves, GI, cardiology, medicine. But this is definitely a field that I'm not an expert whatsoever. So I'm really excited to learn something new. Dr. Verbora is definitely a huge up-and-comer and very interesting person. We share some similar traits. He has his MBA from the University of Windsor. We went to the same med school, albeit different years. I won't tell you who's older. So at the Schulich School of Medicine at Western and residency at the University of Toronto. Welcome, Dr. Verbora.
Thank you for having me.
Great. No, honestly, it's our pleasure. I think it's going to be a really exciting talk. One other key point is Dr. Verbora is also the medical director at Field Trip Health, and he's an expert in the psychedelic space. I think it's a very interesting topic, very topical as well at the moment, and hopefully we'll be hearing a lot more about this in health in Canada and North America. But, you know, one thing that we typically do with Under the White Coat, we try to get to know the physicians a bit better. So, Michael, why don't you tell us a little bit about yourself?
Sure. Well, thanks for that introduction, and I'm very excited to be here. And it's a very exciting time, in my personal and professional opinion, for innovations in medicine. And it's exciting because we're taking a lot of these old plants or therapies or holistic healings from across the world and potentially making them new again. And so it's very, very exciting. You know, how did I get to this point, I think, is really an illustration of me as an individual and my motivations. I graduated, you know, maybe 5 years ago, and it felt like we were kind of at this peak of an opioid crisis. And you know, no one really had strong solutions. So many of my patients in Toronto were on high doses of opiates for chronic pain. And let's be honest, not many of them got better. Most of them got sicker. And so I was really looking for alternative therapies, you know, and medicines for some of the most complex patients. And I entered the field of cannabis medicine. I actually just did an elective, totally, you know, just curious, had no idea that, you know, on my first day, I'd meet children who were cured of their epilepsy after having failed 10 medications with CBD or patients reducing opioids. I had almost zero expectation, just pure curiosity. And after that first day as a resident in that clinic, I was extremely inspired and motivated by the healing potential that I saw with my own eyes with cannabis. And so I decided, because at that time, you know, almost no doctors were prescribing it, very few were educated, and the medical system, education system hasn't caught pace with that. And so one thing led to another, and I got involved in the cannabis space. I've treated over about 5,000 patients with cannabis. I've helped, you know, hundreds and hundreds of patients get off of drugs like fentanyl. And I'm at this point where I'm kind of very, very interested in these complex patients who just find traditional options not helpful for them. And I feel like that population is growing. And so just, you know, the way I think about it is really my area of most personal enjoyment is trying to help the most complex patients who've been through, you know, all the traditional options, have tried a lot of things, they're just not getting relief, and looking for, you know, alternative options that they can safely utilize to try to help with their healing. And that's really what brought me into the psychedelic field. You know, some of my patients were talking about using Psilocybin, which is magic mushrooms, for cluster headaches, which we know we don't have a lot of good treatments for. And other patients were using, you know, high doses of ayahuasca going out to South America, which I had no idea about. And they were coming back, you know, and living a normal life after, you know, suffering severe PTSD. So my patients really inspired me to look into this. And then I joined Field Trip Health just almost about a year ago now. And our vision and our goal there is to really bring these psychedelics with evidence to patients who most need them. And that's my story and how I'm here today.
That's a very impressive story. I hear your little one also in the background. I'll warn everyone. I'm sure I'm going to have 3 of my own storming in at any point in the session. but it goes with the
Yes,
territory in today's world, right? But
absolutely.
that's an amazing story. You know, like everyone always asks me, like, how'd you get into gastroenterology? And I watched a colonoscopy. I found it so interesting. Your story is way better. I might actually use your story.
Yeah, go
Uh,
for it.
uh, yeah, I really want to dive a bit deeper into also the
Sure.
about the psychedelics and mental health. I think, especially with what's going on in the world today, I think mental health is now finally coming to top of mind for most people. The depression, anxiety. I think the whole world seems to be also on edge with very good reason, and I think
Hmm.
it's unmasking a lot of issues with mental health. And I know that's something that you guys are working on quite extensively at Field Trip Health. So tell me, how how is psilocybin being used now for mental health, and what are the challenges with mental health that you see?
Yeah, well, I totally agree. I think we really do have an epidemic with mental health issues, and I think a lot of it really gets buried beneath the surface. And there's still a lot of stigma around mental health, right? And then you throw in drugs like cannabis or psychedelics, and cannabis is really a mild psychedelic, the THC ingredient, and so they can be kind of lumped in and connected. Those are also very stigmatized drugs because of their political history. It's not their entire political history. It has nothing to do with the science, because predominantly these drugs are actually extremely, extremely safe when used properly. There's almost zero toxicity. There are risks. Nothing is risk-free. But when we compare it to other drugs that are legalized, such as tobacco or alcohol, or some of the pharmaceuticals we use for anxiety, such as benzos, or for pain, opioids, they are substantially safer. So I think that whole context is so important. At the clinic today, we run, we say we're a therapy first clinic. And what we do is we're trying to use these psychedelic drugs to supercharge therapy. And so we believe fundamentally that each of us has the ability to be our own healer and to help ourselves heal whatever wounds we have. And what we want to do is just merely be a conduit and leverage, psychedelic drugs to open that space for you. And then with a therapist, a very well-trained therapist, help you understand what that experience is about to carry with you every single day, so that not only are you, getting, antidepressant or anti-anxiety benefits, but you're actually changing the way you live your life every single day rather rapidly to alleviate suffering. And when it comes to these drugs and therapies, it's important to note that a lot of them are still in the research phase. So, there's probably thousands and thousands of psychedelics, but there's probably 5 to 10 that you could say are mainstream. So psilocybin is the ingredient in magic mushrooms. And, it's being studied for diseases such as eating disorders, post-traumatic stress, end of life, anxiety and suffering, which actually we can talk about because it just got approved for some patients. Very interesting. It's a very political case that was just approved by the Ministry of Health. And so that drug, along with other drugs like MDMA, which is, the club drug ecstasy, or ayahuasca, which is DMT, or LSD, the 1960s love drug. Those drugs are mostly still in the research phase. And some of them we have a lot of historical research. A lot of it we're developing today for mental health conditions. The only drug that is a psychedelic that is legal today on prescription is ketamine. And ketamine is not that traditional psychedelic. It doesn't come from nature. It's synthetic. And what's so interesting about it is we used it for 60 years. But we've known for the last 20 years that ketamine is an antidepressant. And at certain doses, it can rapidly produce antidepressant effects. And some of my colleagues in the emergency room for an acutely suicidal patient will give them ketamine right then and there to rapidly change, that suicidality. So we're using that paired with psychotherapy today. But we're also in the process of doing research. So we've applied to Health Canada to do MDMA research with anorexia. And we're also looking at other studies, including psilocybin or DMT, or some of these other psychedelics that may be therapeutic.
That's extremely interesting. You were saying that, was it psilocybin that was just approved for a new indication?
Yeah. Yeah. So, yeah,
sorry, go ahead. Yeah, I was just reading actually that that it was being approved also in end of life. Is that sort of what you were discussing?
Yeah. So there's about 5 patients who have very terminal diagnoses. I think they're all mostly cancers. And they were looking to use psilocybin for end-of-life anxiety and existential anxiety. And Hopkins did a study a number of years ago that showed that one dose of psilocybin 1 year later had an 80% cure rate for depression and anxiety, which is remarkable. Now, there's limitations. The study was only 20 or 30 patients. But what's even more exciting about it is they did follow-ups, 2, 4, 5 years later for some of these people who were still alive. And these patients still report that that one dose and that one experience over those 4 to 5 hours with that therapist was one of the most meaningful moments of their life. And just having the memory of it and being able to go back to that space immediately allows them to be more mindful day to day. So it gets them out of that mental rut constantly because they can go back to that experience, visit it as a memory, and just remind themselves that, like, the stressors that they're worrying about are probably not that important in the grand scheme of things. And so a lot of patients looked at that data and they said, well, look, I'm terminal. I don't have time to wait for, a whole bunch of RCTs. We know that psilocybin, when used properly, is safe. There's not going to be toxicity. You're not going to overdose. So a number of people lobbied the government, including myself, sending letters to the Minister of Health. And I was very pleased for once to get a very positive response from the ministry. And so they've approved the first 5 patients to use it. And a couple of them are starting to go through the process, and they're actually documenting their experience and posting videos on YouTube so that we can educate. I'm not directly involved in any of that care, but mostly just being a patient advocate. And so right now, I guess if people are interested in it and they have that end-of-life care anxiety, you still have to apply to the ministry. And then what's really interesting is you still have to access the psilocybin by whatever means you can illegally. So it'll be interesting to see if we head down the same road of cannabis, which was suing the government and going through the courts to make this as a medicine that was legal. We've taken baby steps now, at least the ministry has, in approving it. So the question is how are we going to eventually source psilocybin legally and have the same controls we have for cannabis? So that's probably the next big question, but it's an extremely important and exciting time. And it's nice to see that our government's having some more progressive views on these drugs.
Yeah, it's very interesting because I think you have a vast experience also in the marijuana field and how it applied to in medicine and in pain. I think I see it very analogous where there was this sort of stigma with marijuana years ago that finally seems to have been breaking here in Canada. I think there's still that. My opinion, in America and around the world, there might be that stigma still going on. Do you find is Canada? Do you find now, because of the changes with marijuana, more progressive compared to elsewhere in the world, or are there other places in the world that are more accepting of psychedelics for mental health and other medical conditions?
Yeah. So a lot of the care that takes place with, excuse me, these psychedelics is predominantly underground. So there's a lot of underground therapists who are giving patients, LSD or ketamine or MDMA and facilitating these experiences and trying to help them heal. So it's still mostly underground because it's not legal. And there are other, states in other countries. So if you look to South America, some of these psychedelics are part of their culture. It's part of their ceremonies for healing. It's part of their spirituality. And so if you look at Peru, it's become this tourist spot for ayahuasca, which is, eventually the DMT drug is what gets absorbed into the body and produces these profound visions and experiences. And a lot of people will benefit from that. But I guess it's not the regulatory framework that, you or I are familiar with. You mixing 2 plants and just making a brew and then drinking a cup of it doesn't seem like a measured dose. And there is potential toxicity to that entire process. And a lot of things can go wrong, and not necessarily all the centers are the same, right? And they're not regulated. So in those parts of the world, very much so, psychedelics are used as part of their culture, as part of their healing. And, North Americans are fleeing over there and getting involved with that. In other states like, Oregon and Colorado, if you look to these cities and states, they're putting, psychedelic drugs on the ballot and or they're decriminalizing them. So some of these places have passed laws that the police cannot spend any money whatsoever investigating any psychedelic related crimes or psilocybin related crimes. So it's a stopgap measure until they can legalize these drugs. But like I'm in the camp where it's like, there's still so much therapeutic potential here. And if I've learned anything from cannabis is we kind of jumped the gun to this recreational market, and it feels like all these medical patients sometimes got left behind. I would have loved if there was more incentive to do a lot more research to get the right data out, to extract the right doses, the right cannabinoid profiles. And I think that we're at that golden opportunity with psychedelics. What's so interesting about psychedelics is actually there's a lot better, RCTs and placebo-controlled trials for these psychedelic drugs than cannabis. So ironically, some of the stigma, at least in the medical community, hasn't been the same level as cannabis, but nonetheless, they kind of come from the same political background, which is, drugs that were legalized at some point, which caused, disruptions in the eco-socioeconomic political fabric, which had to become criminalized for whatever motives. And a lot of the information that was spread about these drugs from, governments and other organizations were not true. They're very false. And so that creates a stigma and controversy about these drugs. But nonetheless, we're at a stage where, the renaissance of psychedelic research is here. Many centers are opening up their own psychedelic research centers, and it's happening very fast.
It sounds extremely exciting. Now, you were talking about how one dose might be enough for the patient. So is that sort of the typical treatment plan? And also, what kind of patients do you envision going down this path?
Yeah, so with psilocybin, the research was predominantly like a big dose, one time. You profoundly disconnect from your ego and your entire, normal life experience. And you reset what's called the default mode network of your brain. And so you get this whole new potential for unfiltered data for those 4 to 5 to 6 hours, depending on the psychedelic. So a lot of the psychedelics are, one and done. And like, it's almost anti-addictive because, it's a lot of hard work. Like a lot of people just think that it's fun and you play with these drugs and, oh, I had all these cool visions and experiences. It's the opposite. Like you do this drug and it's like, wow, that was a lot of hard work. Like I didn't realize I was carrying this trauma from so young at an age. It was buried in my mind. I couldn't recall it. And now I have to really confront that and deal with it because it's, made me tight or made me anxious or made me stressed. So it's a lot of hard work. And that's why we pair it with the therapy so that you have a therapist there to really guide you through these experiences. So what's really interesting about these psychedelic drugs is how, anti-addictive they are. So most of them are one and done. Mind you, we don't have that long-term data to say, are the benefits, 3 months, 6 months, 1 year, 5 years. There is some data showing as much as 5 years of relief from one dose, which is pretty remarkable. That's, not going to be the best pharma model, as you can imagine. So on the other hand, though, ketamine, which is the drug that we use, for whatever reason, people were looking at ECT. And with the ECT protocol, ironically, you get ketamine with ECT and you do 2, 2, and 2 over 3 weeks usually. So, 2 sessions of ECT per week over 3 weeks for a total of 6 sessions. And so people just took that protocol and they started studying it. It's mostly the literature for ketamine is actually with IV predominantly. And so it's just copied the ECT protocol. There's no reason why less couldn't work better or more might work better. We don't have those answers, but it's been modeled off of ECT. So the model that we use is oral lozenges that dissolve in the mouth, paired with psychotherapy, 2 times for week 1 and then week 2 and then week 3. We measure all these scores. Each individual gets a ton of data on their own mental health. And then we're at that stage where we're learning is, do people need to come in for boosters and how often is that? And that's where the literature kind of breaks and stops. And so that's where we're trying to formulate the literature and understand, what are the long-term benefits? What are the long-term risks of using these drugs? And how do we maximize the length of value from 1 or 2 or 6 doses? We strongly believe that pairing it with psychotherapy, so doing the biopsychosocial spiritual model is going to be better than these IV clinics, which are just biochemical. It's merely put you in a room, you get the drug, and the drug does all the work. We think that the drug really opens up the opportunity. It's only with therapy that you can maximize the benefits. But we'll have to put those head to head in the literature to validate that belief.
Yeah, and yeah, it sounds actually very exciting, very promising. In my practice as a gastroenterologist, I see a lot of patients, and be it with Crohn's or ulcerative colitis, or even things like irritable bowel. A lot of my patients ask me, what outside of medicine can we do? Dietary, natural supplements, and I think there is definitely a huge appetite for that with our patients today, and minimizing chronic use of medications for some patients. Now, I can completely understand where some patients are going to come to you and are seeking this out. Is that something that you found? And also, I'm sure that there might be a stigma even with physicians. And do you find that there is sort of a backlash from physicians or even from patients about this?
Yeah. So, surprisingly, I thought there would be a lot of backlash and stigma. I haven't felt it firsthand. If I compare that to sorry, someone's crawling behind me. If I compare that to my cannabis days, I remember I had doctors when I was educating stand up in the room and say I was murdering people by prescribing them cannabis. And so there was a lot more stigma in my experience with medical cannabis, which has obviously died down with, I think, a lot of experience in the fact that we've legalized it and we realized, okay, the world is the same, the sky's not falling in. But what's interesting about psychedelics is because we're really treating such a complex patient of treatment resistant. So these are treatment resistant mental health. We all kind of find ourselves in the same boat, the patient and the practitioner. It's like, what do I do next? Like, you can't just keep throwing more and more antidepressants, at patients with all these mental health conditions, because we know as you get from the second to the third to the fourth one, we know the probability of them working just, is less than 1 in 10. And so you need like a radical approach. So surprisingly, the stigma hasn't been there from the clinician side. From the medical side, like we're getting a little bit of, so patients have to be referred. We want their medical records. We review this. We understand that this is still, a little bit off label. There is evidence, but it's mostly IV, and what we're doing is a little bit off label, but we strongly believe it's a better model and a safer model and a much more long-term benefiting model. So we're very cautious in understanding, specific patient needs, understanding, what their goals of therapy are, and making sure that they're really good candidates who are going to be committed to the process. The last thing we want is someone just coming in for 1 or 2 doses of ketamine, trying to skip out on therapy and using it as like a recreational source. That's the last thing we want. We're doing observational collection right now. We've been approved for observational studies. So all of this data is really important to us to get the best, cleanest data we can to contribute to the literature. But truthfully, the minority have tried that. The hardest part is you get patients who, have complex medical health problems, complex mental health problems. They don't necessarily qualify for the ketamine therapy. So the hardest problem is, gently telling them, the evidence isn't there yet. And we have to wait until, that evidence emerges to treat their mental health problem, which can be, extremely frustrating for a patient who feels like they've tried everything. But this is kind of the art of medicine, is understanding where that line is and who qualifies and who doesn't, what the risks and the benefits are. So no doubt there's still a lot of art in what we're doing, but we're trying to maximize the science.
Yeah, and I think it's, it's very admirable that you guys are working on not only, getting this to patients who are treatment refractory, but also trying to contribute to the literature. I think really I believe you're bang on with that, is, to change people's mind, other physicians, and also for patients, actually having good experiences plus actual data to support this is going to be pivotal. I think, that was a great conversation. I think I learned a lot about the psychedelics in mental health. I think it's very important in today's world, and it's very top of mind for everyone right now. So I wish you guys the best there, and keep bringing forward some excellent data and keep taking care of the patients. I always like to end the podcast just learning a little bit interesting about about each physician. Right before we came on, we were just chatting, and I saw you had a little guy sort of crawling under your feet.
He is. He's still crawling. I'm going to grab him now. This is my little guy, Bradley.
Oh, man.
Yeah, so I'm a dad first, doctor second, but it's been interesting working mostly from home now. And you know what's interesting about his brain is it's mostly in a psychedelic state. If you understand the functional MRI data on kids, little babies' brains, it's that's what we're trying to do with our adults who have a life of learning that sometimes is you know, not therapeutic, as we try to reset that learning for them. So just like a child, right?
Thanks so much, Michael. And great to meet you, Bradley. And I
Nice
have
to
to
meet
say,
you.
like, I'm blown away. My kids haven't barged in here, and I couldn't believe that Bradley sat there for the entire session and you know, was not even making any noise.
Yeah, he did a pretty good job today. Well, thanks so much for your time. I appreciate it, and happy to share this knowledge with everybody. And I'm super excited for the future of psychedelic therapy. And I really do hope that we can help so many people who are still suffering despite the options today really live, you know, much more meaningful lives.
Great. Thanks so much, Michael. And that's it for today's episode. I want to thank again Dr. Michael Verbora, doing very interesting work in the mental health space with psychedelics and with Field Trip Health.